Welcome to the 5th learning module for comprehensive medication management. The purpose of this module is to introduce at a high level the concept and value of comprehensive medication management for patients in primary care practices. In this module, we will be discussing what is meant by a primary care pharmacist. We will also briefly discuss how you can consider adding a pharmacist to your primary care team. Given their unique training as pharmacotherapy experts, pharmacists are key members of the comprehensive primary care team for patients that have complex medication management needs. Pharmacists receive in-depth education and training to identify and resolve medication-related issues using a patient-centric approach. Pharmacists receive education regarding the impact of medications on the body, the integration of patient culture, personal preferences and values, social, financial, and lifestyle considerations, and health literacy in the care they provide. Therefore, pharmacists are recognized as having the expertise to manage medications. Pharmacists receive a Doctor of Pharmacy degree, which is a professional degree that consists of 6 to 8 years of college education. Some pharmacists, including many of those who are primary care pharmacists, have completed additional training beyond the Doctor of Pharmacy program. Pharmacists can complete clinical residencies and research-based fellowships to advance their training to become pharmacist specialists. Some pharmacists in primary care are also board-certified pharmacotherapy specialists, including, for example, board certification in ambulatory care or geriatric pharmacy. Board-certified pharmacists are required to pass a pharmacy specialty board examination that recognizes them as an expert in a certain field or therapeutic topic. What credentials, at a minimum, should a primary care pharmacist have? Ideally, a primary care pharmacist is one that has extensive training, specialization, and education in the management of common chronic disease states. These pharmacists commonly have postgraduate training in primary care, including internal medicine, family medicine, or geriatrics, or training in ambulatory care practice. Pharmacists who complete postgraduate training gain the necessary skills and competency to be able to work directly with physicians, other healthcare professionals, and patients to ensure that the medications prescribed for patients contribute to the best possible health outcomes for chronic and preventative care. Primary care pharmacists have direct patient care experience, either in person within the office or by telephone, or both, to help patients carry out their medication action plan and to empower them to enhance medication self-management. Primary care pharmacists also have experience working with primary care physicians directly to execute medication-related functions as a member of the patient's healthcare team. Primary care pharmacists usually gain their direct patient care experience in the following care settings. If your practice is looking to add a pharmacist to your team, then these are possible locations where pharmacists may be currently practicing. Pharmacists who have primary care experience may be working as a clinical professor of ambulatory care, primary care, or geriatrics within a college of pharmacy or in an academic setting. These pharmacists have a clinical practice site within a primary care or other ambulatory care practice where they provide direct patient care for that practice's patients. This is routinely completed as part of their clinical practice responsibilities as a clinical professor of pharmacy practice. And the remaining healthcare settings listed on this slide, which includes long-term care, managed care practices and organizations, accountable care organizations, independent provider organizations, the VA systems, federally qualified health centers, and other outpatient clinics, pharmacists can be key members of the clinical care team. Pharmacists in all of these settings typically have experience completing comprehensive medication reviews and working with patients and providers directly to assess the patient-level and population-level medication optimization opportunities. Pharmacists in these settings are also routinely involved in other various clinical and performance-based activities, including cost optimization and quality improvement. We will end this module by briefly introducing 4 models that can be used to integrate a pharmacist into a primary care practice. As you can see on the slide, pharmacists can be added to the primary care team in a couple different ways. The type of integration model is dependent upon the practice's medication management needs and volume, patient panel size, as well as the ability to financially support a pharmacist's position. The model selected should fit with the practice or network's current needs. The first model is where a pharmacist is directly hired by the practice. This is an ideal model for larger practices or networks that can financially support a pharmacist working full-time in the practice and where the patient population is large enough for the service to be impactful. In a co-funded partnership, the pharmacist is embedded directly into the practice as a member of the healthcare team. However, their position is co-funded by two entities, usually the practice itself and a local university or college of pharmacy, which is the most common model. This option is a less expensive investment, but it also comes with a part-time pharmacist given the co-funded partnership model. In a shared resource model, the pharmacist could be contracted by a provider group or network to provide medication management services for a set patient population. This model uses a contractual arrangement which can be helpful for smaller practices that may have a smaller patient population or a smaller need or demand for medication management services. In the final and fourth model, which is known as the regional model, the pharmacist is usually employed by a health system or larger provider network, where the pharmacist splits their time across multiple practices within one geographic or regional area. Therefore, the pharmacist is usually part-time within each practice, but is hired full-time by the organization or network to provide services across multiple practices.